Thank you for letting me be here today. Thank you, Sarah, for the invitation. And thank all of you for the work that you do with the American Cancer Society. You are helping patients, families, caregivers. You're making a difference. You're doing miracles every day. And I appreciate it. When Sarah asked me to be here, I'm not sure that she knew that when I got my diagnosis, I made myself two promises. Those two promises were that I would speak about my cancer journey anytime I was asked, and that I would be totally honest with anyone who was foolish enough to ask me to speak about my cancer journey. So if this goes well, she gets all the credit. If not, I get all the blame. I also will say that I realize I may be preaching to the choir with some of this, so if any of this comes across that way, let's consider that the practice session for when I'm speaking to the public. Okay? Before I give you a reason to never invite me back again, let me quickly share my story with you. Starting in about 2016, I was dealing with recurring what we thought were sinus infections and ear infections. I kept going to the doctor. They would diagnose me with an ear infection. They would give me antibiotics and steroids. I would feel better for a little while. I would start to feel worse. I would go back to the doctor. They would give me antibiotics and steroids. I would feel better for a little while. Anybody noticing a pattern here? Okay. What they never did was scope me or send me to an ENT doctor for 2 years. In March of 2018, I had a totally unrelated shoulder surgery. Try saying the phrase unrelated shoulder surgery 10 times really fast. And during that surgery, the anesthesiologist scraped the back of my throat while he was intubating. And I don't mean that he kind of bumped the tube into the back of my throat. I mean, I could look in the mirror and see the scratches on the back of my throat. I don't know what, I guess he was on his phone while he was doing that or whatever. But that mistake probably saved my life. The pain medication from the surgery wore off, and the pain in my throat didn't. My shoulder stopped hurting, but my throat didn't. So I did go to the ENT doctor, and he did scope me, and he saw the damage to my throat, and he says, I think they may have torn something a little farther down. I'm going to send you to a GI doctor, and they can do an upper endoscopy, and we'll check this out, make sure everything's okay, and get you taken care of. So I went to the GI doctor, had the upper endoscopy, and he sent me on my way and said, I'll call you with the results tomorrow. And he called, and it just so happens that at the time my office was upstairs from his clinic downstairs. He called and said, I've got your results. And I said, great, what's going on? And he said, can you come downstairs? They give you good news over the phone. They ask you to come into the office for the bad news. I knew then what I was about to hear, but I pretended that I didn't. For my sake and for the sake of my family. They found a mass. That's what he told me. The ENT doctor scoped me, sent me for that upper endoscopy on March 29th of 2018. I had a biopsy. Now, while the same ENT doctor is wheeling me into the procedure, he's telling me, I've seen cancer before. I don't think this is cancer. I think, I'm not sure what's going on. It may be bruising from the damage to your throat. Don't worry. Okay. He was wrong. But I wanted to believe him. I am a non-smoker. I've never used tobacco products. I do not drink. All the alcohol I've consumed in my life wouldn't fill up a shot glass. I have literally none of the risk factors for throat cancer that make all the bells and whistles go off. Stage 1, no lymph node involvement, small HPV positive squamous cell carcinoma is what they initially told me. They were wrong. Had a PET scan a few days later, and 1 week after the biopsy, I met with the oncologist at the UT Health North Campus MD Anderson Cancer Center, and they said, stage 4, multiple lymph node involvement, large, advanced, aggressive tumor, and we love you, but you need to go to Houston. They can take care of you better down there than we can. When a doctor who is a specialist in a particular field will humble themselves and say, you need to go somewhere else, first of all, you need to trust that person, and secondly, you need to listen to them and do it. It ended up, thankfully, being barely stage 3 with only 1 lymph node involved. However, the tumor was the size of 2 golf balls on the base of my tongue. You may have heard someone mention earlier that for the last 35 years, I have made my living talking. that was when I panicked. I named my tumor Fred for feeble radiation-eating disease because I knew that I had two choices. I was either going to deal with this with humor, which is my nature, or I was going to curl up in a ball on the floor and cry like a baby. And I really ugly cry, and you do not want to see that. So Fred it is. Went to Houston, was evaluated at MD Anderson on April 10th, started treatment on April 27th. So we're going to fast forward. 2 rounds of immunotherapy, 1 allergic reaction to the immunotherapy, 5 rounds of chemotherapy, 1 feeding tube, 6 allergic reactions to different feeding tube formulas, 2 emergency room visits, 1 hospital admission, and 33 radiation therapy treatments later, I finished my assault on Fred on June 29th, 2018. I had my 3rd follow-up CT scan 1 month ago, and for the 3rd time in a row, Fred is NED, or no evidence of disease. Hopefully at 5 years I'll be able to hear the word cured, but with HPV-positive squamous cell carcinoma, they won't even go near that word. I do have some serious side effects, including potential damage to my heart from the chemotherapy. My heart rate is either much slower than it's supposed to be or much faster than it's supposed to be. Right now, shocker, it's much faster than it's supposed to be. I have some physical damage to my throat. I have a pocket that has formed in the front of my throat, and so sometimes when I swallow food, it ricochets off the back of my throat and gets caught in the pocket, and when it does, it feels like I'm strangling. I'm not, but I still have the same physical reaction. I have radiation damage to my salivary glands and taste buds. I'm going to walk over here and grab my water. I have really bad dry mouth, and a lot of food tastes kind of like I remember it, but not exactly. I have hearing loss and constant ringing in my ears. And by that I mean, could someone please turn that smoke alarm off? Because right now what I hear is my voice, silence, and constant. I have peripheral neuropathy in my hands, my feet, and we'll call it my lower back. And I have occasional minor memory loss, or as we like to call our dear friend, chemo brain. So let me share with you the good, the bad, and the ugly from my experience. All right, the good. My life is not over. In fact, despite all of the limitations, I'm enjoying life. My employer, my friends, my church, my family have all been very supportive and unbelievably accommodating through this experience. Everyone involved in my care, with the literal exception of one person, was amazing. Everybody. Everybody was there to comfort, to support, to encourage, everybody except that one person. My radiation oncologist, whose nurses affectionately refer to him as the mad scientist to his face, delayed my treatment 3 times, and I was not happy about that until I found out that the reason he did it was because I had asked him to protect my vocal cords, and he was restructuring my treatment plan to protect my vocal cords. I don't know if you can see it, but there's a pale rectangle right here. It's about 3/4 of an inch wide and about 2.5 inches tall, where he literally turned the radiation off, skipped over my vocal cords, turned it off, skipped over, and then did 40 extra micro treatments to shoot around my vocal cords to get the parts that he missed by turning the machine off while he was doing the general treatment. I love that guy. He has the social skills of an awkward 12-year-old asking somebody on their first date, but I love him. I met a lot of amazing people in person and online, and the resources that are available for cancer patients are just limitless now. Some of them are not good resources, but there are a lot of great resources. Also, with the good, I won't know what my new normal is until 1 to 1.5 years out of treatment. So that is the end of June of this year to the end of January of next year, sometime in that range. So there's still plenty of time for my side effects to improve. They could potentially, some or all, go away. The bad. I won't know what my new normal is until sometime between June of 2019 and January of 2020. So there's still time for my side effects to deteriorate. They could all get worse. They could, some or all, stay forever. Also in the bad, the end of treatment is just the beginning. The effects of radiation, as some of you know, are cumulative and continue to get more severe and painful for several weeks after treatment is finished. They do tell you this. You do not believe them. They are telling the truth. You always feel like you should feel better, but you don't. There's a lot they don't tell you. One of my oncologists finally admitted after I finished treatment that they intentionally withhold information about the severity and side effects of treatment because they sincerely believe that people will forego life-saving treatment if they know the truth. I understand why they do that, but that makes the control freak in me very, very angry. My life, my decisions, my right to make informed decisions. There's a balance between doing what's best for the patient and honoring the patient. I almost died, probably the worst of the bad, several times, from the allergic reactions to the immunotherapy, to severe dehydration, to losing more than 1/4 of my body weight. I got way too close to never coming home too many times. And now the ugly. And again, I realize I may be preaching to the choir. I'm going to share this in the form of 10 things this cancer patient wishes every non-cancer patient knew about cancer. Number 10. When I say I'm fine, I'm lying. Number 9. When you ask me if I'm scared and I say no, I'm lying. Number 8. When you ask, what can I do to help? It makes me want to scream. I am facing the most physically, emotionally, and psychologically trying ordeal of my life. There are 1,000 things that have to get done. And you are now asking me to evaluate whether or not your offer of help is sincere, which one you're capable of doing on that list, which one you're available to do on that list, which one you have time to do on that list, which one you have the skills to do on that list, which one you have the resources. Please don't do that to me. Please make a specific offer of something you want to do to help. Can I wash your car? Can I buy you a tank of gas? Can I take your kid to the movie so she can forget her dad has? Or just show up and mow my yard. I promise I will not call the police. But take that burden off of the cancer patient. Don't make them make that decision for you. And if you're just trying to say something nice, you don't have to offer to help. It's perfectly acceptable to say, hey, I'm thinking about you, or hey, I'm praying for you, even if you don't mean it. It's still encouraging, trust me, okay? If you offer to help, and I trust you enough to accept your offer, do what you're going to do. I was asked to offer constructive criticism. This is it. It is not directed at this office. It is directed at Houston. I realize that Houston is the center of the universe when it comes to getting cancer treatment, and that everything is exponentially busier there than it is here. But I called the American Cancer Society at least a half dozen times for help. They were always very kind, they were always very compassionate, and they were almost always unable to do anything to help me because they were overloaded. Now that's not their fault. It would be great if more people would volunteer, but they don't, okay? But particularly with regard to Houston, it would be good to do a better job of communicating that our resources are limited and that a lot of times we can't help. I'll give you an example. I needed a driver, and they said the wait list was 2 months. I was a week and a half away from finishing treatment, okay? Those are the kinds of things that if you're going to offer help, do the best you can. And I know that. Number 6. Yes. Someone else has told me about your herbal tea, essential oil, eye of nude, holistic lip balm that will magically cure your cancer in one application. But since my care team at the #1 cancer center in the world has never heard of it and they cure people every day, I'm going to sincerely thank you for your compassion while ignoring the crap out of you. And if you persist, I may also block you on social media and in real life. Just stop it, okay? Number 5. Yes, I'm lonely. Cancer is not just a disease. It's a place. And once you get here, you can never go back. It is lonely here. And often being alone while you're lonely makes it even scarier. So just come sit with me. You do not have to say the right thing. You do not have to say anything. Just being matters. Flip side of that quarter, while I am lonely, sometimes I also need to be alone. Yes, it's a paradox. You just have to have. Sometimes I need to be able to just think, or to kick a piece of furniture, or to punch a wall, scream at God without there being any. Be okay. Number 4, please do not ask my family about me without also asking about them. They are dealing with cancer too, just from a different vantage point. When you ask about me but not about them, you are minimizing their pain and unintentionally discounting them. Number 3, no, I am not okay. I'm different. My current different may be less bad than when I was in treatment or immediately after treatment, but that does not mean I'm okay. I may be okay eventually, or I may just have to get used to my new normal, but I will never be who I was before. Now, in my case, that's not necessarily a bad thing. I was 50 pounds overweight and I lost 65 pounds, so I win. But we all need to get used to the fact that once you've had cancer, you're not who you were. Number 2, and this is harsh, and I apologize if this doesn't apply to you, but it needs to be said, and you are welcome to repeat it to anyone who will listen. Unless you have had cancer, and in many cases, unless you have had the specific cancer that the patient you're talking to has, no, you do not understand. Please stop saying it. It hurts. Number 1, I don't know if my cancer will return, though statistically it's more likely that it will than not. I don't know if the damage to my heart is. I don't know if I'm going to be able to eat normally again. I don't know if my hearing will return, or if the ringing in my ears will go away, or if I'll get the feeling back in my fingertips, toes, bottom of my feet, and lower back. I don't know if the chemo brain will ever get better. And I'm okay with not knowing, which should lead you to ask why. Because in my very weird life, I have been shot, stabbed, hit in the head with a brick. The brick broke, which explains a lot. Run over by a car. You should see the car. Almost died in a car crash. Believe it or not, it was not my fault. Almost died from an anaphylactic reaction to a medication. Also not my fault. Broken my back and been told that I would never walk again. They were wrong. And those are just the really bad things that have happened to me. But nothing has brought me closer to the people I love and to God, or strengthened my faith more than my journey with God. I could tell you 100 stories about how God has blessed me through this experience. But then you wouldn't buy the book, which interestingly enough is going to be called The Blessing. Thank you.